Hey everyone, good day to all. Today in this video, I am going to talk about some cholinergic and anticholinergic important drugs for our FMGE examination, guys. So I am sure shot that from this table only you will get 1 to 2 MCQs for sure. Okay, so first of all, guys, we are going to study about the myasthenia gravis. I think you know about the myasthenia gravis. So what is the investigation of choice? It is the single fiber electromyography. It is not the hydrophonium or tension test. If they ask what is the investigation of choice, it is for the single fiber electromyography. It is also a July FMGE 2024 exam question. Most of you guys mark the hydrophonium, but it is not the investigation choice. For the clinical test, guys, you will do the hydrophonium. So if the symptoms improves, it means having the myasthenia gravis. For the clinically, we will do the hydrophonium. For the investigation of choice is the single fiber electromyography. Please don't do the mistake. So what type of hypersensitivity it is? It is type 5. If in the options there is 2, 3, 4, 1, then mark the type 2 is the correct answer. If in the question, if they give 2, 3, 4 and 5, then mark the type 5. Always prioritize 5. If there is 5, then mark 5. If there is 2, 3, 4 and 1, there is no 5, mark 5. No 5, there is mark 2. Always prioritize the 5. It means they want to test you that if you know or not. Myasthenia gravis is type 5, you know or not. Okay. So coming to the treatment, guys, this is going to be very important. What is the treatment for the mild guys? You will give the pyridostigmine. Pyridostigmine, if there stigmine, and if there is no, if pyridostigmine is not in the option, then mark as neostigmine as the alternative drug. Pyridostigmine is better because it doesn't cross the blood-brain barriers, but neostigmine crosses. That's why we'll give the pyridostigmine. In the severe cases, we'll give the steroids. For the myasthenia crisis, we'll give the IV immunoglobulins. If they ask what is the treatment of choice, drug of choice is pyridostigmine, but treatment of choice is the thymectomy. Hope you guys clear. Okay. Now I am moving to the other topic is the Alzheimer's disease. For the Alzheimer's disease, they will ask you which anticholinergic drug is used in the treatment of the Alzheimer's. So it is they'll give rivastigmine, donepezil, galantamine. These three are useful in the treatment of the Alzheimer's. But which is the better one? The better one is the donepezil. You have to mark the answer as the donepezil. In other way, they will ask you which of the following Alzheimer's drugs are used as the patch form. Intradermal patch forms. It is the rivastigmine. Rivastigmine used as the patch form. Okay, dermal patch. Okay. So guys, one thing here that anticholinergic drug used in the treatment of the Parkinson disease. For the Parkinson disease, guys, we are having the benztropine and benhexel. This is used in the treatment of the drug-induced Parkinson. See here. For the drug-induced Parkinsonism, it is the benztropine and benhexel is the treatment of choice. For the trihexyphenidyl, it is the anticholinergic drug used in the treatment of the Parkinson disease. I will come one more time. See, if the question says that anticholinergic drug used in the treatment of the Parkinson disease, it is the trihexyphenidyl. If they ask you guys what is the treatment for drug-induced Parkinsonism, it is the benztropine benhexol. Hope you got it. So coming for the poisoning, guys, What is the drug of choice for datura? Datura means what? It's called Atropa blandona. It means they are asking for the atropine poisoning only. It is the physiostigmine. Antidote for the datura poisoning is a physiostigmine. Datura, what is the full scientific name? It is the Atropa blandona. From this one only we are extracting the atropine. See, datura or atropine are same only. Okay, now in the question, guys, they will also they will give a scenario. They will say that which of the following it is used for the treatment of the salivating. See here, before surgery, prevention of saliva. Before the surgery, for the prevention of saliva, you can give the drug is called as glycopyrrolate. Glycopyrrolate. It is the glycopyrrolate. Before surgery, you have to give for the prevention of saliva. It is the glycopyrrolate. Okay. So for the fundoscopy, guys, for the doing fundoscopy to visualize the pupil, for the people to visualize the other inner organs, inner cells, you have to dilate the pupils. You have to dilate the pupil. So in the case of children's, you will use the atropine as a dilator. In adult, it is the tropicamide. Adult tropicamide. Children's, it is the atropine. And coming to the one thing here, guys, for the motion sickness, they will give in the history as a patient went to Ladakh, a patient went to some mountains. Okay, now for that one, guys, it is the drug of choice is the hyoscine or scopolamine. For the treatment of the motion sickness. It is available in the patch form, dermal patches. You have to put the patch before 30 minutes going to the mountains or traveling. Okay, now next one, apart from the motion sickness, there is one sickness called as morning sickness. For the treatment of morning sickness, it is the doxylamine. You have to add the vitamin B6. Are you okay? The next one is the, guys, there is one here case for the urinary retention. For the urinary retention and the hyperactive bladder. Hyper means more urine. Okay, now bladder is not in the control. Here is bladder is relax stage. Okay, now see, not it is the see, bladder is contraction state. That's why no urine coming. So it is the urinary for the urinary retention. Post-operative ileus. It means ileus which decrease the motility. And the post-operative urinary retention, you have to give the bethanachol. See how to remember? Bowel and bladder. Bowel means what? Ileus. Bladder means what? It is the urinary bladder. So for the bowel BB, it is BB, and the drug start with the B also. It is the bethanachol. That is the bowel bladder. For the urinary retention, you give the bethanachol. For the hyperactive bladder, guys, for the hyperactive, more urine coming. For the hyperactive bladder, guys, you have to give these drugs. Any drugs in the question, in the examination, they will give all these one. So you have to choose you have to be differentiate between the urinary retention and the hyperactive bladder. That is the oxybutynine, mirabegram, and trospium and tolifenacin. These are the drugs you have to give in the case of hyperactive bladder. And also, guys, I want to tell about that here for the beta agonist. These are the adrenergic receptors. I included here to remember. So as you know that beta 2 agonist, we know that it's a SABA and LABA used in treatment of the bronchial asthma. Okay, short acting bronchial, short acting beta agonist and long acting beta agonist. So for the short acting gas, we will know that it is the salbutamol, formoterol. See, salbutamol, it is the short acting, I know. For the long acting, so how to differentiate is the, in the long acting drugs, we will see always metrol. Drug will end with metro means metro motor. It means these are the long acting beta agonist. Okay na? These are long acting beta agonist. So what are the, so these are used in the treatment of bronchial asthma. What are the side effects? Side effects are very important. We get the reflex tachycardia, palpitation, not hyper, hypokalemia, hyperglycemia, hypotension, headache and tremors. They are the side effects of the beta 2 agonist. You have to remember this one, guys. So guys, in the case of intranasal corticosteroids, examples budesonide. For this guys, you will have the side effect as the oral candidiasis. It is the oral candidiasis, or it is called as oral thrush. For this one, guys, you have first of all, you have to prevention. We have the prevention, like you have to always do the mouth rinsing using spacers, and also for spacers. For this one, guys, if it doesn't cure, you have to give the antifungal creams. Best one is the nystatin, or you can give the clotrimazole or mucoconazole creams. Okay, are you listening? Okay, done. Last one is this is the very important. This is very important. See guys, if the patient is having hypertension and BPH, benign prostate hyperplasia. If the patient having hypertension and BPH, for the symptomatic treatment, it is the tamsulosin. It is the tamsulosin, also called as silodosin. It is silodosin. Okay na? For the hypertension, for the BP and having hypertension BPS, for the treatment, it is josin drug. That is the prazosin or terazosin or alprazosin. There are prazosin also used in the treatment of the scorpion bite. Please remember this. Please remember these tables. You will get 1 to 2 MCQs. Please. Thank you so much.